Hello, and welcome to the Salvation Army Kroc Center's COVID-19 protocol training. This is designed to inform employees, volunteers, and others of precautions being taken to limit exposure to COVID-19 and to ensure you understand your role in helping to keep everyone at the Salvation Army Camden Kroc Center safe. We have been strictly following the mandates of the CDC, state, city, the Salvation Army Division and Territorial Headquarters for closing and reopening of our Camden Kroc Center. As the details of reopening remain fluid, we trust that this presentation will provide you with an overview of the changes that have been made at the Kroc Center. Before you leave your home, employees, volunteers, and others are recommended to do self-screening and temperature checks at home before they come to work, and to stay home if they have symptoms of acute respiratory illness, signs of a fever, shortness of breath, cough for at least 24 hours. Employees, volunteers, and others must notify their supervisor if they exhibit any of these symptoms before they come to work. The supervisor must then immediately update the Camden Kroc HR manager of any such conversations. Employees, volunteers, and others exposed to a coworker or family member with a confirmed case of COVID-19 will be asked to conduct a risk assessment to assess their potential exposure pursuant to CDC guidance. The risk assessment requires employees, volunteers, and others to assess their risk level and whether they are symptomatic or asymptomatic. If testing of COVID-19 is confirmed as positive, we will inform fellow employees, volunteers, and others of their possible exposure to COVID-19 in the workplace, but will maintain confidentiality as required by the Americans with Disabilities Act. For those who believe they have been exposed to the virus causing COVID-19 and are fever-free without the use of fever-reducing or other symptom-altering medicines for more than 24 hours, contact the Camden Kroc Center manager to discuss coming into the center. Upon entering the Kroc Center, each employee must certify that they, 1. have no signs of a fever or a measured temperature above 100.4 degrees or greater, 2. have no signs of a cough or trouble breathing within the past 24 hours, 3. have not been asked to self-isolate or quarantine by your doctor or public health official, 4. have not had close contact with an individual diagnosed with COVID-19. Close contact means living in the same household as a person who has tested positive for COVID-19, caring for a person who has tested positive, being within 6 feet of a person who has tested positive, or coming in direct contact with secretions, example, sharing utensils being coughed on, from a person who has tested positive for COVID-19 while that person was symptomatic. If you are exhibiting symptoms or unable to self-certify, you will be asked to leave the Kroc and seek medical attention and applicable testing by your healthcare provider. You are not to return to work until cleared by a medical professional. After you have certified that you have no COVID-19 symptoms and no known exposure to COVID-19, you will be required to have your temperature taken. Non-contact thermometers will be used. Temperatures will be taken by designated personnel. If you have a temperature of 100.4 or higher, you will be asked to go home and not return to work for 48 hours after you are fever-free without medication. Masks are mandatory. Based on the CDC and state requirements, masks are required to be worn while you are inside and outside the building at all times, unless you are in your own office or you are eating. Employees, volunteers, and others may wear their own masks as long as they comply with the Salvation Army and Camden Kroc dress code and meet CDC requirements. Disposable masks are available. All masks should be kept clean. Wash your hands before you put your mask on, and after you take it off, touch only the strings, not the mask itself. While you are wearing your mask, you should not touch it since the outside of the mask is exposed to germs. Gloves are available at several stations at the Kroc Center. Remember not to touch your eyes, nose, or mouth with your gloved hands. Gloves should be disposed in the trash and should never be reused. Gloves should be taken off by rolling the gloves inside out to limit touching the outside of the gloves which has been exposed to others. Social distancing must be practiced even if you're using gloves and a mask. They are added protection only. One of the best ways to reduce the spread of COVID-19 is through social distancing. Deliberately increasing the physical space between people, staying at least 6 feet away from people lessens your chances of catching COVID-19. During meal and break times, please sit 6 feet apart from other employees. Employees, volunteers, and others with offices should use non-direct methods to attend to business matters. For example, use the phone, Teams, others, rather than stopping in person. Employees, volunteers, and others, breaks and meal times will be scheduled on a staggered basis to reduce congregating. Staff can eat in designated areas such as Town Plaza or the patio deck. Please clean up after yourself and throw all trash away in the receptacles. Employees, volunteers, and others should bring their meals, if possible, to reduce the traffic in and out of the building and thereby reduce exposure risk. Social distancing should be maintained in all restrooms. Hand washing is mandatory after restroom use. Paper towels are to be used in place of air dryers. Any restroom concerned should be immediately reported to your supervisor. Hand washing and sanitizing are important precautions to slow the spread of COVID-19. The following steps should be taken. Wash your hands often with soap and water for 20 seconds, scrubbing in between fingers and including your wrists. Avoid touching your eyes, nose, and mouth with unwashed hands. If you do not have ready access to soap and water, use an alcohol-based sanitizer at one of the many sanitizing stations located across the center. Clean and disinfect objects and surfaces that are touched frequently. Example, phones, doorknobs, keyboards. Staff will have designated office supplies and they should not be shared. If sharing is necessary, wipe down the utensil before and after you use it. Cleaning staff will be sanitizing throughout the day. However, if in doubt, wipe down any surfaces that you may come in contact with prior to using. Each department will have cleaning supplies. If you do not find them readily available, please reach out to your supervisor. You will need to use paper timesheets to track your time in and out and any breaks. Moving forward, the situation is constantly fluctuating and we will need to continue to adapt as new information and guidance becomes available. You play a critical role in keeping one another safe. If you have questions, please contact your supervisor or HR for clarity. Thanks for all that you do to serve our community.